family take trips through town and often stop to get ice cream. Brian's mom says Willow encourages more and more friends to meet Brian. Willow teaches us how to be patient and kind. Willow is learning to follow gestures and signs from Brian, who is nonverbal. She makes every day a little brighter for all of us. Justice helps her friend not feel weird. I never used to go out by myself. People would always stare at me. Now everywhere I go with Justice, people smile at me. And they come up to me. It's really nice to have that connection with people. Animals can be warm and fuzzy, non-judgmental, good listeners, trustworthy, but most of all, they provide us with unconditional love. Animal-assisted therapy first occurred in the late 18th century, when small domestic animals were used to improve the socialization among the patients at a hospital. Recently, we are starting to use animal-assisted therapy as a more conventional treatment for a variety of patients. While there are many different styles of therapeutic treatment, it is very common for people seeking support to pursue multiple types of therapeutic methods. Patients undergoing traditional counseling or medication only often decline medically or terminate treatment without achieving their overall goal. Animal-assisted therapy is operated with a well-trained and certified animal and the animal's handler. The patient, the animal, and the handler all complete an interview process to ensure that all who are involved will be able to be successful during treatment. Animal-assisted therapy can involve any type of animal, but is most commonly known for horses, cats, and dogs. It is important to note that animals who engage in pet therapy are not considered service animals. Service animals are protected by the American Disabilities Act. They live with their owners who have physical and emotional disabilities and assist them with daily living. In contrast, therapy animals work with professionals and clients. Pet therapy dogs do not require any special training other than the basic obedience skills. When the patient establishes the specific goal or goals, choosing the correct animal for therapy can then be determined. A patient may be interested in improving their reading so they can seek better employment. By reading out loud to an animal could improve their skills by decreasing their embarrassment they feel by others. Pet therapy can take place in a wide variety of locations, such as hospitals, including psychiatric centers, nursing homes, schools, or even people's homes. Because animal-assisted therapy can be successful for such a wide variety of clients, it is important that more patients are able to take advantage of this specific treatment. People who undergo chemotherapy treatments, major surgeries, or long-term health issues may also benefit from animal therapy. Typically, these animals give support while uplifting their spirits of the patient. Also in the setting, the animals can assist in redeveloping the person's strength and their motor skills. Animal-assisted therapy can accommodate patients who have intellectual or physical disabilities. Individuals that are diagnosed with autism can work with pet therapy to help with social skills, to help them become more confident in communicating with people. People diagnosed with behavior challenges can also benefit with working with a pet because this can build or improve their patience, their trust, and their compassion. There have been reports that the senior population can also affect from pet therapy because it can give them a sense of purpose. By having to get up and take care of something can be motivating. Having something to do to look forward to can also assist with loneliness and depression. Many studies have been conducted with persons who are or have engaged in pet therapy. The overall consensus cited that the positive effects of their mental and physical health. Animal-assisted therapy can improve physical health by lowering the blood pressure, improving cardiovascular health. It can release endorphins that provide a calming effect. It can also release a relaxation response in the body. While working with a pet, the patient may improve their ability to move farther, faster, or even exercise longer. Mental health can also be affected by pet therapy because it can improve the feeling of loneliness, boredom, decrease anxiety and depression, as well as possibly help dementia patients remember memories of their own past pets. There are a few risks involved in animal-assisted therapy. This can include people who are allergic to pet dander, and they can have reactions while working with the animals. Critics may fear for safety of the patient, but there is an extensive screening on all the animals and their handlers before the therapy is initiated. So I ask you, the next time you spend time with your favorite animal, take time and think, how did that animal make you feel? Did your barking friend motivate you today? Did the purring from your cat relieve anxiety? How many times can people say they leave a doctor's office without a prescription for medication, but they leave a prescription to spend time with your furry friend?